Good morning, good afternoon, and good evening. My name is Johanna Wong. I am the Senior Monitoring, Learning, and Knowledge Exchange Specialist at SEBI-Livestock, the Center for Supporting Evidence-Based Interventions in Livestock. This webinar is co-hosted by ourselves, the Livestock Data for Decisions Network, or LD4D, SPARC, Mercy Corps, and MarketShare Associates, and presents work funded by UK Aid. So today we'll be having a discussion led by Dr. Elizabeth Daly, SPARC's Gender Equity and Social Inclusion Advisor. Liz has worked on gender issues in relation to land and natural resources in rural settings for over 20 years and has focused much of her work on pastoralist communities over the past 12 years or so. So I'll hand over now to Liz to moderate the conversation.
Thanks, Johanna. Thanks, everyone, and a big welcome today. Millions of pastoralists in drylands depend on livestock for their survival, yet conflict, climate change, and poor access to animal health services threaten their way of life. Women play a crucial but often overlooked role in livestock management, facing barriers in time, mobility, and decision-making. The SPARC project, Supporting Pastoralism and Agriculture in Recurrent and Protracted Crises, SPARC, is a research program that works with donors, governments, and communities to inform more feasible and cost-effective policies and investments in drylands, primarily in Africa and the Middle East. These are regions that are often impacted by climate, conflict, and food insecurity. You can find out more about us on our SPARC website. The link to it should have been, well, it has just been posted in the chat. I can see it there now. So in this webinar today, SPARC and our partners Mercy Corps, MarketShare Associates, and Livestock Data for Decisions, which we also call LD4D, some of you will know them as, will present insights from field research on two key issues. The first one we're going to look at is how behavioural and gender norms impact animal health service access in Ethiopia and Kenya. And the second topic we'll look at today is key learnings on designing more inclusive interventions for gender-inclusive animal health services in Karamoja in Uganda. So that'll be drawing on some of our SPARC research. Our speakers today will highlight scalable, gender-inclusive solutions that can enhance resilience, improve livelihoods, and ensure sustainable livestock systems. So we're really looking forward to discussing with you as we go along about the policies and innovations that empower women and drive prosperity in pastoralist communities. I'm really excited to introduce our first speaker, which is Johanna Wong. She's the Senior Monitoring, Learning and Knowledge Exchange Specialist at SEBI-Livestock, and she's standing in for Julie Koehler today. Very unfortunately, Julie's been caught out with travel delays, so we're very grateful to Johanna for stepping in at such short notice. Johanna's going to frame our conversation for us about women's empowerment in pastoral livestock systems. She's a veterinarian with 10 years of experience in livestock development, food and nutrition security, and in academia. Very passionate about supporting deeper inclusion and gender integration within livestock development and the use of data towards transformative change. So Johanna, please go ahead, over to you.
Thanks, Liz. Well, I'm sad that Julie can't join us. I'm really, really happy to be here today. Many of you might know me from our gender and livestock data community of practice, where the topic of pastoralism and women's empowerment in this space has come up several times over the last few years. So why is this such an important topic? Climate change and the resulting land use adaptations have had a deep impact on pastoralist communities. This impact is felt in shifts in the gendered roles and responsibilities at a household level, and yet the social norms and the animal health systems are not changing at a corresponding pace. In a space where women's marginalization means access to animal health services is already limited, when their livestock keeping duties transform, often increasing in workload, there's a real risk that the household social and economic benefits from livestock decrease when women cannot access essential services. Whether it's from restricted mobility to access to these services or weak social networks putting women at a disadvantage to find quality animal health services or products, the real cost of animal health services are higher for women, and the benefit women and their families gain from livestock is less. To change this, we need empowerment to be both a goal and a process. So it's not just access to the services that needs to be addressed if we are going to achieve the household level social and economic benefits from livestock within pastoralist communities. We also need to incorporate strategies that address decision making around animal health and the agency or personal belief necessary for women to feel that they are entitled to that decision making space. Providing access to female animal health service providers is essential, but so is the understanding that this is part of their role in livestock keeping. Just a quick note before I hand over back to Liz. If you are working in livestock and are passionate about gender equity, please do join our Gender and Livestock Data Community of Practice. We'll put a link in the chat shortly because we come together every other month to talk about important topics like this. Thanks, Liz.
Thanks, Johanna. Thanks for that great framing for our conversation today. So let's move to our second speaker. I'm delighted to invite Noura Kamel to share about gender-inclusive animal health services in Kenya and Ethiopia. So Noura has over 17 years of experience in strategy, program implementation, and systems-informed evaluation aimed at expanding economic opportunities and driving sustainable impact. Noura is the Director of Research and Impact at MarketShare Associates, which is a global advisory firm focused on bringing actionable insights for development. And Noura is part of the leadership team. She oversees projects for foundations, multilaterals, and NGOs across Africa and Asia. And with SPARC, Noura's led the collaboration focused on behavioural and norms-responsive animal health systems for pastoralists in Ethiopia and Kenya. So Noura, welcome and over to you.
Thank you so much, Liz. Thank you. And it's so great to be with everyone here today. I'm seeing all the participants. Thank you for joining the session. We look forward to engaging with you today. I wanted to take a quick moment to share about MarketShare Associates and our work. So Liz mentioned it briefly, we're a social impact driven global consulting firm. And really what we do is we specialize in market research, partnerships, program implementation, and evaluations. Since we've been established, we've completed over 150 projects across 55 countries, so really work across the board. Our hubs are in Toronto, Canada. That's where I'm based. We have colleagues in Denver in the US, Kampala in Uganda, Dhaka in Bangladesh, and Amman in Jordan. As an overall principle and practice in our work, and something I'm very proud of, is we really very much deeply integrate in complexity and use a systems approach to design kind of all of our work and solutions that work within dynamic context. And what we do, and another thing that I'm very proud of, is we work in deep collaboration and partnership with private sector, government, and civil society. And this partnership is really one of them. So we can go to the next slide. We partnered with SPARC to conduct a study on behavioral and norms responsive animal health systems, focusing really on Ethiopia and Kenya. And this work was done by Conrad Baluma, Jacqueline Folster, and myself. Conrad's online, so it was Jacqueline. So say hello in the chat, please, Conrad and Jacqueline, with many contributions from a lot of wonderful people who gave their time to give their perspective, like Ermias Yeshak, Khalifa Bey, Ali Raykov, Dinara Abilova, Carolina Pimentel-Correa, and many, many others. So we're deeply indebted to a lot of people who gave their time to us, and much gratitude to Carmen Jaquez and Guy Jobbins and all the SPARC team. So let's move into some of the insights from the work. We'll go into the next slide. So we studied how women and men access and interact with animal health systems. And we covered really 2 pastoralist communities in Ethiopia, in the Somali and Oromia regions, and 2 in Kenya, in Isiolo and Samburu. It was a deeply qualitative study, so we had lots of key informant interviews, in-depth interviews, and focus group discussions with pastoralists. We heard from 192 pastoralists, mostly women, and we spoke with over 88 people at the community and national and regional level, and had 64 in-depth interviews. So we listened and engaged with a lot of people to arrive at some lessons and recommendations that I'll be sharing here today. So I'll focus on 4 key lessons, and we can go to the next slide. The first is that quality animal health services are generally out of reach for pastoralists. And interaction with formal animal health delivery system is minimal. The majority of formal services are in urban centers, and so the interaction is very much minimal. When animal health services are within reach for pastoralists, they tend to be inadequately resourced and or too costly. So that's the first kind of overall lesson and finding. The second piece is that role allocations between women and men pastoralists have evolved. They have become more flexible based on what we heard from study participants, with women and men increasingly doing livestock management tasks jointly. We'll talk a little bit about this and highlight it in the recommendations, but what we learned through the study is, to a large part, role shifts have been a response to external changes, very much climate change, droughts, etc. And most participants who we spoke with considered the current division of labor, how things are going, as generally appropriate, but multiple times, actually, quite predominantly, we heard about the increasing work burden and time pressures on women. But let's share in the next slide 2 more lessons from our work. Women and men pastoralists that we interviewed told us that while men are primarily responsible for seeking out animal health services, women do actively take on this role in certain circumstances, when they're a household head, and we spoke to a few of those, when the men are on the move, whether they're with livestock, sick or unable during emergencies, and women are primarily responsible for that for small ruminants. And finally, number 4 is that pastoralist women, compared to men, face specific challenges to accessing and interacting with animal health services. Restricted gender norms, social norms, both at the household level and the community level, still limit their mobility. We heard from many respondents about kind of what the limits of socially acceptable interactions with male animal health service providers are, and that's still very much dominated by male men. Time poverty and overall disproportionately less knowledge about animal health compared to pastoralist men. And we'll talk a little bit about that as well. So those were the 4 main, lessons and insights from hearing and listening deeply with all of our study participants. So based on this and a lot of analysis that we conducted of the data, we highlight today 3 kind of recommendations to address some of what we've seen. Number 1 is to really bring animal health services closer to pastoralists through last mile, inclusive last mile delivery, and I'll talk a little bit about that. Number 2 is to make the animal health services that do exist more inclusive and more norms responsive, and we have a lot of insights from this study and others about what that looks like. And number 3 is closing the literacy gap, but specifically to this topic, the animal health information gap. I'll take a couple of minutes, Liz, if you'll allow me, to go through just a couple of recommendations specific to each of these recommendation areas or recommendation buckets. So we can go to the next slide. The first one, under bringing animal health services and products closer to pastoralists. Our research really highlighted how important strengthening public-private partnerships are to de-risking and incentivizing animal health service delivery in hard-to-reach communities. And we focused on the 2 countries, so I'll just share a quick nuance there. So in Kenya, where the animal health system is private sector-led, future development programming may be required to support that public arm of PPPs to overcome constraints that private sector actors face and can't really play much of a role in, which is, or maybe the role is limited, such as infrastructure, security gaps in dry lands, etc. So that would make delivery not only plausible, but it could also support the private sector in assessing where might there be a market opportunity, a business case, as we say, to provide services in those areas. In Ethiopia, where the animal health services are, or the system is much more public-led, PPPs could help crowd in or attract and accelerate private sector investments to support overall delivery. Under the second recommendation, and this is really very much the heart of much of our research, how to make existing animal health services more inclusive and responsive to those unique needs of women pastoralists. First, I would say expand the number of women providers through gender-sensitive recruitment and training. We heard loud and clear that there aren't many women providers of animal health services, and the interaction with male animal health service providers is very much limited for women in pastoral areas. So this could significantly improve their access and interaction with the system. The important piece here, and I know one of our colleagues who really very much supported on this research in Ethiopia and has a wealth of knowledge on this, is that sustainability aspect. And Aramis, if you're in the room, please introduce yourself in the chat. The important piece is really ensuring that that provision is sustainable. It's not about training a number and kind of them disappearing in a year or two. How do we use social and behavioral change communication, role models, all of the tools that we have in our toolkit to make sure that some of this is lasting so that women are able to access it over time. The second piece is about the remote aspect. How do we enhance and expand? There are some solutions out there. How do we enhance and expand access to digital solutions that allow women to interact with providers remotely? You know, all of us were around for the COVID pandemic, and it's not yet a distant memory, unfortunately. But just as human health service provision was possible remotely during the COVID pandemic, there are opportunities to expand that kind of remote access to digital solutions to overcome that kind of distance, to overcome the issues with interaction with males in person, et cetera. And maybe in the interest of time, I'll just jump to the third recommendation about closing very much, especially the animal health information gap. Through our research, we learned that really when women pastoralists actually told us that much of the information that they get about animal health is really being channeled in through their husbands, male counterparts in the family, in the wider community, et cetera. But very much from filtered, not direct, and their limited interaction with the animal health system obviously really affects that as well. So to be behaviorally and norms responsive, animal health information really needs to be presented in languages and formats that reach pastoralist women. Really, we're talking about prioritizing visual approaches, meeting women where they already tend to convene, not asking them to come somewhere, be it community meetings, weekly markets, etc. And really here partnering with last mile animal health service providers could be very effective to making sure that service providers are really community-based and reaching women pastoralists where they really are. So I'll pass it back to you, Elizabeth, and I'm happy to discuss further.
Thanks so much, Noura. That was a great summary of the research that you've been doing with SPARC. Let's move on now to our final speaker, who's Dr. Maureen Kamusiime. She's a technical advisor with Mercy Corps, one of the SPARC consortium partners. Maureen leads climate smart agriculture and livestock resilience efforts at Mercy Corps. And she's going to talk with us today about gender inclusive animal health services in Uganda. Maureen's got a strong background in policy advisory and program management, and she shapes strategies on climate change, livestock and agriculture. Maureen's work in Karamoja and beyond has strengthened community resilience and positioned Mercy Corps as a leader in sustainable inclusive development. Maureen, it's a real honour to pass the mic to you to share with us. I know you're going to talk to us about why pastoralist women are so central to livestock systems and yet still overlooked in service delivery. Maybe I can just pose you a couple of questions. What hidden barriers did you find in your research that prevent women from accessing animal health services, even when they're willing to pay, and what opportunities? And then I think we'd really like to hear as well, how can we redesign service delivery to fit the economic rhythms and realities of pastoralist communities? So over to you, Maureen. Look forward to hearing from you.
Hello, everyone. My name is Dr. Maureen, as introduced. Today, I am pleased to share insights for over a decade of our livestock programming. This will be focusing on how we can design more inclusive that reflects the lived realities of pastoralist women. Of course, they are central to the systems, but are often overlooked, as Elizabeth mentioned. So our work with Masiko combines applied research and on-ground implementation. So I hope it offers some practical ideas in shaping service delivery in the drylands. Before diving into what we learned about gender inclusion, I want to ground us in the broader context of our work in Karamoja. So for over a decade, we were working to, our livestock portfolio had two main objectives. One was increasing public and private investments into animal health services, of course, by increasing government allocation and private sector participation, but also improving access to high-value market for the pastoralist communities. This is through production and productivity, and of course, that's where animal health really plays a central role. As you can imagine, we began our work mostly with men. Pastoralist societies are patriarchal, so it made sense since the biggest participants in the value chains were men. However, we came to the realization that women are critical to livestock health. Usually, they're the first to notice when an animal is sick and are open to trying out new practices. Yet barriers like time, poverty, limited mobility, lack of decision-making power often prevent them from accessing the services. Therefore, engaging women is critical to successful animal health interventions. Next slide, please. The pastoralists, both men and women. So in engaging the pastoralists, both men and women, we realized that yes, they were willing to pay for animal health services, but adoption remains low. So we explored it a bit further. As you can see, that bar chart shows us where money is spent, household expenses. So we found that while households report that animal health services are expensive, and they do pay for them, providers do not see the equivalent revenue. Where was the gap? Pastoralists were often buying from informal sellers. It wasn't about distrust, but it was about timing. When the cash is low, women turn to more accessible but less regulated options, which are not always good. So access to animal health services is not just about proximity, it's also about cash flow and economic timing. So let me acknowledge this up front. Yeah, the chart looks a bit messy, but it reflects the financial juggling act that pastoralists are constantly managing. Each line represents a different income stream, and together they show how delicately these households balance their resources throughout the year. So for this discussion, I'd like us to focus on the first three lines: goat sales, buying and selling of larger livestock, and local brew. You might be wondering why goat sales are separated from livestock transactions. That is because when they sell the larger animals, often it comes with significant reinvestment costs, like buying younger animals to replenish the herd. In many cases, the net income from these transactions is much less than what you would get from a goat sale. So the pastoralists really separated these two sources of income. Now look at the gray boxes in the chart. These show periods of peak disease outbreaks. So through our research and implementation, we found that these times coincide with peak household expenses, like buying inputs for agriculture, as well as covering back to school costs. So even when animal health services are available, households may not simply have the cash to access them. So this data reinforces one critical insight. Access to animal health services is tightly linked to when the money is actually in hand. It's not about the willingness or awareness about the animal health services, because even the trusted services will go unused when there are competing demands. This highlights why we need to think not just what services we offer, but how and when we deliver them. I'll speak more about that in the next section. So one of the key and strongest takeaways from everything we've done in Karamoja is that it's very important to align animal health services with the financial rhythms of pastoral communities. For example, when services are offered during times when households have disposable income, such as after livestock sales, we see a higher uptake. Coupling these services with saving groups has also made it easier for women to pay for animal health care when the need arises. it's a simple yet powerful shift that responds to the way money flows in these communities. So equally important is how we engage the communities. Success comes when we work through specific influences and social structures that shape both the men and women thinking. For example, we realize that information shared during local church services is often more trusted by women than what they hear on the radio. We've also seen real impact when we invest in women's technical capacity, as Noura mentioned earlier, training them as livestock caretakers and even community animal health workers. The few that are there that stick within the service system expands the reach of the services, but also challenges the traditional gender roles in a positive way. When these strategies are backed by gender transformative approaches, we start to see changes in behavior, social norms, and even supply chains shifting to better organize and recognize the support of women's contributions. Our recommendation is to build strong and more inclusive animal health systems. You need to start by gender intentional assessments. These help us see whether women are already active and where barriers exist, so we can design this matter from the start. We should also lean into women's strength and their deep knowledge of livestock and their willingness to innovate. And to make this stick, we need gender transformative approaches that shifts who holds decision-making power, not just in homes, but in markets and institutions. So it's not just about inclusion, it's about building systems that work for everyone, including women. Thank you. I'll hand it back to you, Liz.
Thanks so much, Maureen. That was really interesting. I just want to, before we move on to discussion, I just want to pick up on your last point there and just ask you a follow-up question. You were just talking about the shifts that happen with empowerment when women start moving to becoming decision makers. So what actually happens when women move from being recipients within the animal health service systems to being decision makers and even service providers in livestock systems? Has your research told us anything about that?
Yeah, so when women take on more active roles, such as decision makers as well as service providers in the systems, the entire ecosystem shifts socially, economically, and structurally. How we see services have a higher uptake because women are more likely to engage and trust with fellow women providers. The peer model fosters early identification and treatment of animal health issues, improving herd productivity and household income. But the impact far goes beyond livestock. Empowered women, we know, reinvest in their families and communities, driving improvements in nutrition, education outcomes, as well as climate resilience, as is the case in most drylands. So they become champions of sustainable practices, influencing behaviors and decisions that shape the long-term community well-being. So most powerfully, I would say women's leadership begins to shift the entrenched social norms. They are recognized as experts. I should know because I was one of the first women vets in the area that I went to. And girls and younger women find new role models, supply chains adapt and become more inclusive and effective, reinforcing the positive cycle of equity and impact. So the short version of that is when women lead, livestock systems don't just improve, they do transform. And that is what we are all aiming for. Thank you.
Yeah, that's fantastic. I thought you might say something like that, and it's really good to hear that the impact is so significant. I just want to ping another quick follow-up question to Noura, and this links to some of the questions that are already starting to come through in the Q&A. Can you just talk a little bit more about the private-public partnership programs and pilots? And actually, what I'd quite like to ask you, whether there's any examples that you could maybe just give us a comparison of some that have worked and some that have not worked to improve animal health access and use specifically for pastoralist women.
Thanks, you. I love that question. I think, I always like to think about what works and what doesn't work because we, equally learn so much from that. And maybe I'll start with one example from our research that we found that worked quite well, was really promising. There were public-private partnership models for last-mile delivery of vaccines. They were called Give and Deliver in Ethiopia that showed, some willingness to pay for preventative care, and really focusing on vaccines. For the Give project, field agents, and I really, this is a wonderful kind of aspect that they integrated. The field agents themselves included women service providers to deliver those services, those vaccines, and they were quite positively received, despite initially some skepticism from elders in the community. And I really wanted to highlight because it came up very loud and clear in our research, and as well as in Maureen's research as well, about the importance of those women providers being part of the system. So that was really promising. And the important aspect as well is that this is for preventative care, which is where we like to see a lot of willingness to interact, because it's less costly for everybody involved, the pastoralist, the system, loss of animals, so a huge economic cost to that. Perhaps one that if you read about it, you would say, oh, I wish that this was a what works example, because it sounds so good on paper, right? So especially in remote areas. Which is mobile animal health provision. So this was trialed specifically among pastoralists in Kenya. There were some trials as well in India and in Bangladesh, and as well in other areas, also around the same time. And what they found is that, yes, that mobile animal health provision did support that final last mile delivery of animal health services. These mobile vet clinics or veterinary clinics roaming around really in Kenya did not prove at all financially sustainable. There was very, very minimal, what we call modest willingness to pay for a full range of animal health services. And some colleagues would even go further and say there are so many mobile clinics just sitting there gathering dust, parked and gathering dust. This really doesn't work. Although it looks wonderful on paper, what a great idea, it really did not prove financially sustainable. And so really not very much something that continued.
Great, thanks very much, Noura. And let me just pose a question as well to Johanna, which is really just to give us a sense of what do we still need to know to continue doing our work?
Thanks, Liz. Look, we need data. We always need data to do the work. There's so much great research coming out of SPARC, Mercy Corps, ILRI, and other organizations implementing and partnering in research with pastoralist communities in the Horn and across the African continent. From the polls that we've had earlier, many of the people in the audience here are deeply involved in work with pastoralist communities as they adapt to the effects of climate change. So bringing all that data and evidence together and including research that's still to be done, that's what will help drive effective decision making for how programs are resourced and how they get redesigned to match the needs in the context.
You guys are putting lots of questions in the Q&A, and some of them our team are already answering. But there's a lot of different interesting angles coming up, and I think we'll move now to throw some of these to our speakers to address. I'm going to start with two questions, and I think they're related, and I'll probably ask Noura and then Maureen to comment on them. So these have asked what safeguards are in place to ensure that expanding digital animal health service solutions does not further marginalize women who lack digital access or literacy. And the second question, which to my mind is also related, how do you propose balancing gender-sensitive training with existing cultural norms in conservative pastoralist settings? And there's obviously a link around there, perhaps with literacy and education levels and digital access. So I think we can pull those together. Noura, would you like to comment on that first? And then I'll ask Maureen to comment as well from your different countries that you've worked in. Thank you.
Yes, sure. And honestly, there are a few questions in the Q&A and possibly also in the chat about kind of that balance between how do you flexibly and find ways to make gender norms, find ways to make them a little bit more flexible, to expand the space available for women in pastoralist communities, very patriarchal, without doing it too fast and really causing more harm. So I think that's an aspect that that we looked at in some of our research. But one of the key things I would share here is that involving men in the soft, slow, intentional shifts is critical, whether it's in this research or other normative research that we've done in places like Uganda, in Bangladesh. Doing this in absence of men really fires back, and does not lead to what we hope that it will lead to. So definitely involving the women, or the women and men moving alongside each other. We're doing some research in Morocco right now where this is part and parcel, very, very much core of the design that we are looking at. And it's hard to see that, you really want to move these social norms forward, but these are deeply held social normative beliefs. So it's about kind of working with women who have these, who are champions for some of these movements, working with men who might be champions for them, and working with the ones that very much are opposing or kind of have those deeply held beliefs. So really working with the variety of views out there, but doing this much more slowly than sometimes we like to do in development efforts.
Thanks, Noura. Maureen, would you like to add anything on that topic?
Yeah, I would first like to agree with Noura's submission. Involving men from the get-go, making sure that they're involved in every aspect of the training or decision-making is very critical. We've realized that actually there are a lot of male champions within the pastoralist communities. I would like to also weigh in on the digital inclusion piece. So as I mentioned earlier, bundling animal health services together with savings is very key. So we layer that intervention, because for most of the savings, at least here in Uganda, we have gone digital. Banks encourage women to have a digital presence, use of mobile money, etc. So with that, there is, we've seen an increased uptake or demand for mobile services and phones. So if you look critically, practically bundling certain interventions with others that promote digital inclusion of women would also go a long way in improving other services that can be provided digitally, including animal health services. Thank you.
Thanks, Maureen. And that actually leads quite neatly into another question in the Q&A. What is the additional cost to use behaviour change communication to help men appreciate the work of women and support their decision-making and their control of income? What have been the most effective methods? So I guess there's two parts to that. Would be the most cost-effective as well as the most effective methods. I don't know, Maureen, if you've had any experience with using behaviour change communications as part of your program, if you could speak to that. Otherwise, I will maybe open that up to Johanna or Noura to come in and try to answer that one. So we're asking the additional cost to use behaviour change communication to help men appreciate the work of women and support their decision-making and control of income.
So SBCC, we know, is very slow, and the uptake is really, and it requires targeted campaigns. In one of our RIFSAs, we did a huge campaign of having male champions, as well as like these one sentence statements. I support my woman to do this. Are you doing it? On T-shirts. People have talk shows about it, community engagement. So I'm not saying that's the most cost-effective way to do SPCC, but it has gone a long way in changing attitudes and mindsets, especially when you try and target the younger audiences, because those are the ones that are developing, are still not yet set. So even in schools, doing such kinds of targeted messaging there is very helpful in changing the mindsets.
I can add a quick comment, Liz. It's really important for all of these, any sort of livestock program, to be building in these considerations. Like, it does cost extra time and budget to build this work in, and it needs to be incorporated from the start. And so that's why being knowledgeable about how to include gender into your program while you're designing, while you're talking about the budget, it's super important. So yes, it's sometimes more difficult to build in when you're already started and running. And that's why we need to get everyone thinking about it from the design phase.
I think just one thing to add from my perspective, Liz, very quickly, is that, we think about the additional cost of social and behavioral change communication, integrating it from the get-go. It is an additional cost. Sometimes what has helped us, try to build the case of why it's important is thinking about the cost of not including it, right? The cost of not having social and behavioral change elements in the design from the get-go. And I know there are a few, of my colleagues and both in the organization, other partners who have deep experience in gender-sensitive programming, and this is something that they really swear by, right? It's hard, it's long work, it's arduous, but it pays off in the long term, and the cost of not doing it is substantial as well.
Johanna and Noura, for those extra thoughts. Now, I just had a question here that actually a different angle on that. How do you incentivize or de-risk private sector involvement in animal health? How do you balance digitizing with the human touch in services, which is obviously critical for serving rural women? And Gaetane is asking, any good experience on gender transformative interventions? So again, we're talking about the private sector here. Noura, can I pass that to you first?
Yeah, quickly, and I love this question, Gaetane, and this is why, in the first recommendation coming from our research, we're really talking about inclusive, but also market-oriented last mile delivery, right? And so one of the examples I shared of what worked was actually a PPP with the vaccine last mile delivery. So that was a very good example. De-risking private sector, I mean, just from this work, but much more broadly from market systems work and private sector work that we've done. The reality is that private actors will not move into a space unless there's a business case. That is just the reality. And trying to convince them to do so it may work in the short term, it just will not work sustainably. So de-risking private sector investment by having, that's why there was so much focus on the PPP element, the public-private partnership element from our work, is that you do need some investment from non-private, not the private sector, be it the government, be it development funding, to really help the private sector move in, at least to demonstrate, to assess whether there is a business case, to see if there might be, and then based on this, then help move. That has proven effective in programs where we have worked, be it in this case or in other areas, water, food, food systems, etc.
Thank you, Noura. I would like to just pick up on a comment we've got here, noting that a lot of these issues have been discussed for 30 years or more, and a number of organizations have been attempting to address them. And yes, I mean, that's a good observation. And there's sort of a comment, I guess, question that there's been not much discussion yet about the types of diseases and who has the responsibility to deliver things like vaccination campaigns. So in Ethiopia, the community and animal health workers are involved in delivery of vaccination campaigns, including women. Maureen, I just wonder if you can comment on anything from your experience in Uganda about that.
My experience in the Karamoja region, first, I would say that the animal health services are two-pronged. So we have the diseases, the TADs, the transboundary animal diseases that are under the control of the government. And then we have the normal production diseases, tick-borne diseases, that is under the private sector. As Noura was explaining in her previous answer, it's important when it comes to when it comes to disease control programs, make sure there's a partnership between the government and, of course, the private sector actors. It's actually also a way to encourage private sector participation, because most of the times the markets are flooded with free services from various actors. So if we can make sure that that market is not distorted, it would go a long way. Back to the question on diseases, which ones are of economic importance? So there are those, like for example, the transboundary animal diseases like FMD that cause an institution of a quarantine, really have huge economic consequences, because all markets will be closed, and in the pastoralist communities, of course, we know the backbone is livestock. So when they cannot buy or sell livestock, it becomes a very big issue. I remember during the COVID lockdown, there was also an FMD quarantine, and with all the inflation issues, it was really a very bad situation in Karamoja. So, however, that's not to say that the other diseases are not important. Tick-borne diseases, we know that in as much as FMD is a TAD, it does not cause a lot of mortalities. However, tick-borne diseases do this a lot to the herds. So they would have a huge economic impact on the production of the animals at the household level, and of course, loss of the herds. The other way to encourage the private sector is, of course, do those trainings on preventative animal health care and catalyze the market such that as they know that we are waiting for vaccines, but for some of these diseases, it's actually better for me to, for example, do a deworming that costs around 1,000 Ugandan shillings rather than losing my animal, which costs 2.5 million. So it's a mixture of very many things, but I hope I have answered. That's my long-winded attempt to that question. Thank you very much, Liz.
Not at all. That's really interesting. And I think the point we're kind of underlining here is that obviously every context has got different diseases and different priority concerns, but we're looking also at the broader issues for making animal health services overall more gender inclusive. I'd just like to come to a couple of questions here. We've got Michelle North has put in the Q&A. She says, I'm curious whether these projects have also followed up on how empowering the pastoral women has been seen by the men in the communities. So what are the perceptions of men in the communities? And Michelle's wondering how quickly such cultural changes can filter throughout the system. So I think we could probably have a whole entire a day of conversation on that one, if not more. But just related to that, a sort of following question from Elizabeth Nyaibo Malu, and she's asking whether women's livelihoods' main roles are changing, and what are the key drivers of change and impacts in livestock production today. So a little bit about change of women's livelihoods, changes in empowerment of pastoral women, how those are kind of connected, and you know, what have you seen in your research about how men are perceiving some of those changes that are coming through the systems? Maybe I'll start with Noura for that one.
Yeah, sure. And I love what you said. I'm trying to find it in the I think I just found that it was a response to one of the questions. Elizabeth, thank you for that. Maybe just two things from my perspective, and I'm sure Maureen will have others and others on the call as well. In the research that we did, and we had already seen, right? We didn't ask specifically and explicitly the men pastoralists, hey, we've seen a change in the roles. What do you think of the, we didn't ask them over a specific period or a specific role, etc. But we did ask about appropriateness of the division of labor and the roles. And by and large, they, in general, felt like it was appropriate. I wish I could pull up one of the quotes that was so powerful that we found, but in reality, many of the respondents are, even though, it was the majority of women saying this, but yes, they thought that it was okay the way that the roles have shifted are and how they're divided. But the reality is that women were now facing what the literature often refers to as a triple work burden, right? So they were doing the work, they were doing the household, they were doing the childcare, they were taking on a lot more on their plates, not really letting go of some, not necessarily to say that they don't want to let go, but none of the other stuff on their plates are actually really being reduced. So it's, that really came quite clearly about the question mark of, is this going to be, that kind of time poverty on women and the excessive burden. I do want to say as well on the changing livelihoods, though, that this was a very clear kind of question that came up. I mean, in our own research, we saw how men were venturing out, men pastoralists were venturing out and diversifying their livelihoods by small sales, moving a little bit to centers, even in rural areas. There is a study that we're actually conducting in both in Nigeria and South Sudan in collaboration with SPARC, specifically focused on this diversification of livelihoods and what we like to imagine creatively, this bricolage or collage of how are people making do and evolving their livelihoods. So stay tuned on some of the results from that work as well on specifically livelihoods.
Thanks. Thanks, Noura. Maureen or Johanna, would either of you like to come in on that? Maureen, perhaps?
Yeah, thank you very much. I would refer back to that very messy slide of mine when it came to the delicate balance that pastoralist household go through to just provide for their needs. So we're already seeing diversification, changing of roles. But I'd like to weigh in on what Noura said. It's sometimes I feel that we need to do more when it comes to, of course, the burden of the women. Yes, they're willing to take on these roles, and yes, sometimes it's not even an issue that they're perceived the wrong way by the men, but that time poverty, time to do everything. I want to do this, I want to do this, I want to be a community animal health worker. And that made me realize that even during our implementation, it was usually the older women, the ones who are past childbearing and the biological responsibilities that actually stuck in. But I have no solutions, but I'm thinking we continue on and see where we land, because it's important that we build inclusive systems.
Absolutely. And I might come straight back to you, Maureen, actually, with another question that's in the Q&A. Do you have ideas on how private sector animal health service providers can be attracted to thin markets, such as those in arid areas? So I think that actually picks up nicely from what you've just been talking about. Do you have any ideas for that?
Yeah, that's a work in progress. However, when it comes to thin markets in the dry areas, we know that we, the implementers, are also responsible for choking the private sector. We provide a lot of free services, and we have this perception that pastoralists are not willing to pay. And the thing is to ground it in research. So one is to know, for example, what we did was to find out the prevalence of disease. Knowing the prevalence of disease, turning it into the economic cost or benefit for the private sector, framing it in such a way that the private sector can understand that this is the total addressable market here. And then also catalyzing the communities so that they know that these services are available here, this is the cost. And of course, encouraging them to do preventative animal health services, which are a bit of a less cost, but the private sector would benefit from providing those in terms of presence and building the trust with the communities. So it's a combination of very many things, but one is to make sure that governments and people like us, the implementers, are not choking the market, showing them the possibility that actually there is profit in those areas, and of course helping them build the community relationships, trust, and the demand for the products. Over.
Absolutely. And I'm going to come on this topic again around private sector to Noura. We've got another question. Does your research consider which animal health services are highest priority for animal survival rates in these regions? And so therefore, which have the greatest economic benefit for pastoralists? So that's on the pastoralist side. And then on the private animal health service provider side, which Maureen's just been commenting, I just wondered if you could say something about the potential for private sector providers to be influencers and to think about expanding their customer base towards pastoralist women. So kind of thinking about a little bit more about some of the economics of this. Thanks, Noura.
Yes, of course. And Sarah, I love that question. Thank you. And I think that deserves an even follow-up study focused on, okay, you know, really ranking which of the services are most critical for you. But I will say this from our research, because of the you know, the inadequate availability, the expensive nature of animal health services in these remote areas, what tended to happen, and this was across the board, is that pastoralists, especially women, but across the board, they were accessing animal health services a little bit too late. Right, when we have already crossed the threshold of what could have been done to under the preventative bucket, right? And so that's what we saw very clearly from the research, is that they were going in for treatment, whereas they could have probably avoided this through accessible, affordable last mile delivery of preventative care. They do oftentimes, to meet this, and this was predominantly the practices, they mixed in those ethno-veterinary traditional practices themselves as a first line of defense before they seek out the animal health services. So I would say, from a critical economics perspective, and I love the angle that you focused on, having them see the value of preventative care, and that really related to that third recommendation I shared, that animal health information that really helps pastoralists understand the value of preventative care, how much money they could save by accessing preventative care, but also matching that with affordable preventative care that they can use, is really critical, based on what we heard from the participants as well.
Thanks very much, Noura. I just spotted another, well, there's a couple here actually that quite a few of you are talking about access to digital technology. Again, we touched on this a bit earlier, but I think perhaps we can just try to cover off this issue of access to digital technology again. How did you achieve pastoral women accessing to digital technology, considering the fact that most of them are not educated? And then we also had another question, again, how can we improve access to digital tools and provide hands-on training to sustainably boost animal health productivity? And there was one more that I think I saw in here also, referring to any case studies talking about women pastoralists being involved in animal health services where where there's education gaps. So coming to some of these, sorry, one more as well, actually, what safeguards are in place to ensure that expanding digital animal health service solution does not further marginalize women who lack digital access or literacy? That was Mohammed Ayaz Kirio. So quite a few of our participants today are talking about this access to digital solutions and issues around that. So who will I call on? Who would like to jump in and perhaps talk about that first?
I would love to share one thing, and I know, Maureen, that was a big part of your research as well. But just a couple of perspectives on this. We didn't directly, I mean, the scope of our research wasn't directly to kind of assess the full range of coverage of digital tools, but this is a couple of things on this. From this work and previous work that we've done, digital is always seen as oftentimes seen as what a wonderful solution that's going to solve everyone's problem. And, jokingly, a lot of people refer to it as the shiny new toy, right? Where it's like, okay, remote, throw mobile, throw digital, problem solved. And the reality is that that doesn't solve the problem. What we have seen from this area and in others, number one, is that mobile penetration rates in these remote areas are dismal. So, to think of digital solutions that rely on mobile when people don't have mobiles makes it very difficult. The second piece is that when they do have mobile access, we didn't test it in this area specifically. We didn't ask specifically about this, but in other contexts that are similar to this, the ownership and use of the mobile phones and kind of digital tools was very much concentrated with males in the household, not women. And so it would be very difficult if you're trying to access women pastoralists and they don't have the mobiles and someone else has them, and they have to ask for permission for use. You're introducing another dynamic that falls under the, how do you do gender sensitive programming that doesn't that is a little bit balanced. So that's the second one. The third thing is that, I rely on a livestock related project that we have running in Morocco right now. We're going in to ask to do focus group discussions and key informant interviews about digital technology use in those communities before the integration of mobile solutions in those areas. So we're going to go in and ask, how do you usually understand how people, what access they have, how they use it before going in. And we think that, at least the hypothesis, I will report back, that this will help, if they introduce it, make it a little bit more effective rather than throwing a digital solution at a problem and it not work.
Thanks, Noura. Maureen, do you want to add on to that?
Yeah, thank you so much, Noura, for that. I like your reference to the shiny new toy, where everyone thinks that's the solution. As I said earlier in my presentation, we have to work with the channels which are friendly to the women, to leverage on where they're strong if we really want to encourage inclusion. So when it comes to digital literacy, it was something that we also went in with the assumption, yeah, everyone has a mobile phone. Let us, the banks are on our necks. But one thing that we do know is that women save. There's one thing that is common across very many geographies in Africa. We like to meet for savings and catch up a bit on the gossip around, but have that sort of social networks around savings. So we realized that the women do not have the mobile phones, but when it came to digitalizing their savings, there was a willingness to have a cost share, especially from the financial institutions. So my thinking is, if we can leverage some of the existing well-working digital platforms or other interventions that are doing well, we can easily include the women. Like, for example, we found it easy to meet women at the savings groups to pass on information about animal health, as well as in the churches, the places where they are. We start from where they are and not think that the digital solution will solve everything. Maybe for urban women, that would be a solution, but in the pastoralist context, it's still quite different. So that's my take on that question. Thank you.
And Liz, just to jump back very quickly.
Sure.
Not to say that the digital solutions are not out there and can be helpful. So, I mean, it's even included in one of our own recommendations to address the remote nature, right? And we see examples, for example, that for being able to take pictures of a sick animal, being able to interact and exchange about questions, to really try to triage. But you have to make sure that when you are to be able to expand that and know that women are reaching it, you have to start with, do they have access to this technology and do they have some influence over the use?
Thanks so much, Noura. And we could have another entire webinar just on that last topic, I suspect. It's really great discussion. There's so many questions still in the Q&A and in the chat, which we haven't had time to get to. We're coming to kind of our final 20 minutes. I want to just go back to each of our three speakers to share one key takeaway from today in 2 minutes or less. The key highlight for you from the discussion that you'd like everyone to take away with them. Johanna, you first, please.
Thanks, Liz. My key takeaway is that households don't operate as a single unified unit. Social and economic benefits of livestock are not equitably distributed within the household. And this is often compounded for communities that are existing at the margins of societies, as pastoralists often are. So many livestock projects, they want to have a positive impact on household nutrition, food security, children's education. We see it all the time. But if we want to realize those benefits, we really need to make sure that the benefits of livestock development are equitably distributed. And that includes working to transform animal health systems to be accessible to both men and women livestock keepers. Thanks. I really enjoyed the speakers today as well. Thanks.
Thanks so much, Johanna. And again, thank you so much for stepping in for Julie. We really appreciate that today. Noura, next, 2 minutes or less, your key takeaway, please. Thank
you, Liz. And I'm really appreciative of all the interaction and engagement with everyone today. Thank you for your questions. I mean, if I were to focus just on a couple of key takeaways, they would be this: quality animal health services tend to be out of reach for pastoralists, especially women. It's either because they're unavailable or they're too expensive. So going forward, animal health services have to be brought closer to the pastoralists themselves through this kind of inclusive last mile delivery that I talked about, very much related and responsive to those norms and how they affect behavior, right? Women pastoralists, from this research and from the body of knowledge that many of you have referred to in the chat, they can be at the center of preventative animal health. And this is very much critical to their own livelihoods, but also much more broadly to the sustainability of livestock systems and pastoralism as a way of life and livelihoods. So, this is, for me, the broadest key takeaway to really keep from today. For us, it's been really a deep pleasure to collaborate with SPARC partners on this work. We, for us, learned firsthand about how much the pressure pastoralist communities are facing to quickly adapt to climate change. So it's very critical to have research that is practical with solutions. And many of you in the chat have talked about solutions and asked about solutions as well, and proposed some from your own experience. Our approach is grounded very much in this, action learning. And I spoke about kind of very much integrating a whole systems approach, not really focusing on one specific outside of all the external influences and interactions with the system. So we're keen to help expand this body of knowledge and practice. If you're designing or scaling animal health and livestock promotion programs, or looking to embed learning systems that support this kind of adaptation and continuous learning, please connect with us. We would really very much love to hear from you. Thank you.
Thanks, Noura. Maureen, key takeaways, 2 minutes or less from you on your key takeaway for today, please.
Yeah, my key takeaways, as we've seen, when we are designing inclusive animal health services, it means rethinking the delivery. Not just thinking that, yes, let women access, we really need to rethink and centering women as clients and contributors, as well as catalysts for change. I would like to especially bring back my my earlier submission on designing matching services to seasonal income patterns, because as we say, we are looking for systemic change, and we need uptake and want the private sector to really participate in this space. But in as much as we've gone as far as encouraging willingness, the pastoralists know the value of treating their animals. But the problem is we are designing it in such a way that when we are bringing these services, or when the service providers are there, that's when they do not have the cash. So my key takeaway is to design according to the income patterns. I know it's a very difficult process, mapping each and everything out, but it would go a long way in ensuring the success of animal health programs. So I'm thinking that is my key takeaway for today. Let us design inclusive animal health services, but let us add another layer of matching this to the income patterns for it to be a bit more sustainable. Thank you.
Thanks so much, Maureen. That's fantastic, all of you. And what a great discussion it's been. I'm so sorry we haven't managed to get to all the questions, but we've had so many and it's been great to have all the engagement. Just a few final things that I just want to flag up, thinking about following up from today's discussion. So next year is the International Year of Rangeland and Pastoralists, and it's also the International Year of Women Farmers. So let's all keep engaging on the issues for women pastoralists. There are different working groups you can join in relation to those international years. There'll be at least a whole month focused on gender within the rangeland years. And then from SPARC, a reminder to check out all the great research on the SPARC website. We've put the links in the chat, and I think it will link to the website. It's just gone in the chat again. And the two policy briefs that the research we've been talking about today from Maureen and Noura, which we have just published two policy briefs related to that. So the links again for there will go in the chat. They're also available on the website. The titles for those, behavioural and norms responsive animal health systems for pastoralists in Ethiopia and Kenya. And the second one, the use of gender transformative approaches in pastoralist societies, what we know about what works and recommendations for a way forward. So you can see those, hopefully those links work in the chat, or if not, go to our website or contact the speakers. We'll let you have access to those. You can also hear more about some of SPARC's research on gender coming up if you're attending the LANDAC conference in Utrecht. From the 2nd to 4th of July, we're having a SPARC session there as well. And very much want to keep engaged and involved with all of you. So that's it from me. Big thank you again to everyone for such great engagement, and of course to all our speakers. And I'll just hand back over now to Johanna to formally close what's been a really brilliant discussion. Thank you so much, everyone.
Thank you, Liz, and thank you everyone for joining us and giving us your time to be here, being so engaged with the presentations and with your questions. Thank you to the team, not just the speakers, but everyone behind the scenes who did the work on the ground so that we have information to share today. The background prep for the webinar, it's very much appreciated. Please do, everyone, check out the resources that are placed in the chat. As a reminder, we will share today's meeting recording with everyone in the next week or so. And with that, we will also share out all these links and the information again. We'll also try and gather the questions that we didn't get to during the discussion today and ask the speakers to provide short written answers so that we do get to everyone's comments and questions. If you want to get in touch with any of the speakers, please reach out to LD4D and we will connect you. And lastly, please join the LD4D Gender and Livestock Data Community of Practice. Listen out for announcements about our next community conversation. And the link was just put there in the chat again. So thank you so much. Thank you everyone for joining.